Pediatric anesthesiologists do much more than simply put a young patient to sleep before surgery. They're in charge of medical care throughout the surgical experience. Pediatric anesthesiologist Dr. Eleanor Reimer knows that. However, she began her medical journey as a nurse and went on to practice medicine in some challenging places, from Africa to the Northwest Territories, still does sometimes. It is my pleasure to welcome Dr. Eleanor Reimer to the broadcast.
Thank you.
Nice to see you, and
Great
for a
to be
good
here.
reason.
Mm-hmm.
Not that a good reason isn't helping children survive surgery,
Yes.
but also the telethon coming up on Shaw this weekend.
Mm-hmm.
A World of Smiles.
That's right. We like to see children smile.
Mm-hmm. And you do like dental anesthesia too, right?
Yes, unfortunately, lots of children have a lot of teeth that need to be repaired, and they can't tolerate sitting awake. I think there's a lot of adults who would prefer to have some help with their dentist. So
That would be
yes,
me.
Yes, so we do a lot of that as well. It's very
I'm
important.
Sure. Well, my dentist always gives me a half a Valium.
Oh,
Just a
really?
half.
Okay.
Because I sit up in the chair, and I'm one of them, right? And it doesn't really hurt that much anymore, but in my day, it did.
Yeah, we used to get tortured, didn't we?
We got tortured, and so now you say, well, I'll never forget that. We don't forget torture. So your role in the operating room?
It's a bit of an amusement between the surgeon and the anesthesiologist. We are two physicians, and I like to think of one's not really the boss and one the leader. We really work together. And I just had an interesting conversation. We just hosted an international health conference 2 weekends ago. And most of anesthesia in the developing world is still given by nurses or officers with very minimal training. And I talked to one of the surgeons and I said, wouldn't you love to have an actual physician there helping you take care of the patient? And they said, of course, that's what we want.
Yes.
And seeing it through their eyes. So my role is basically through the whole pre, intra, post experience to just make it safe and comfortable for the children.
So what's different for you taking care of a young patient as opposed to taking care of an older patient? What's different?
Kids are honest. You can't trick children. And they are, you know exactly how they're feeling. Like, they don't internalize. If they're upset, they're going to cry and scream and cling to moms. So, but they also know who's being truthful to them. So
Right.
I always tell the truth. And it's just amazing. They sense that in you, that you really care about them. And it's unbelievably rewarding. And one other thing is, you're never just looking after the patient. You're looking after the whole family. So you've got the family around you as well. That's important.
So can mother or father go into the operating room, or are they still in the other room?
That's something that I was very pleased to be involved with. About 15 years ago, we recognized that taking screaming children out of parents' arms is not good. And we'd end up using drugs, which also we prefer not to,
Right.
even though I'm an anesthesiologist.
Right.
So we started to bring one parent in just until the child's asleep. It's hard for the parents to see that, but being a parent is hard. So that's what I always tell them. You've got to be strong for your child. You've got to be there for them, and it makes a huge difference.
No, it's hard for a mother or a father to take the baby for the first shot.
Yes,
You know.
exactly.
What kind of anesthesia are we talking about for a child today? How has it changed since you began?
Well, the drugs, most of the drugs and gases, which is
Still gases.
still gases, are the same as in adults. Just the doses are very different, and that's why you need special training. And but they're a lot better. So they're shorter acting. So almost all the surgery that we do, at least 60 to 70% of the surgery we do, we can get the kids asleep, do the procedure. We can give them medicine while they're asleep so that they wake up relatively pain-free. They can recover. And obviously not drive home, an adult can't,
Right.
but they can go home the same day. And there's nothing better for healing than to be in a familiar environment with the people who love you and to be at home. So that's what's really changed. And anesthesia has allowed that to happen, day surgery. So the kids come in, they have their surgery, and they can go home the same day.
Unless it's a more severe case, say a cardiac case, or are some young cardiac patients going home same day?
Yeah,
No.
We are doing a lot of cardiac procedures now that we can do it minimally invasively.
Right.
So threading catheters up into the heart, replacing valves that way. Even those kids have to stay one night just for monitoring. But,
Sure.
but you know, potentially they go home the next day.
And how much anesthetic can a child take? And by that I mean, say you have many operations as a young patient. Is there a time when you say, I know when you're older they say, you know what, you're 80, I don't think your body's going to be able to handle it. What does it do to the body?
That's a really good question. And kids are amazingly resilient. And when you look at doses that children require, particularly once you hit the age of 1, you actually need almost double the amount of anesthetic drug to go to sleep. You know, some of these answers, this is a tricky question because we're starting to do some animal research and find out that anesthesia in the very developing brain, the neonate, the premature baby, it's not good. But I always tell families who are worried, we know that doing a painful, frightening procedure on your child is detrimental to your child's development. We never give anesthesia unnecessarily, ever. So it's far better to treat the pain, treat the anxiety, give them an anesthetic, than to try to do these things, holding a kid down in a dental chair. That is traumatic and has long-lasting effects.
Yes, we are living proof.
Yes.
Or I am, for sure. So new children's acute care wing coming?
It's an acute care hospital. It's going to be a massive, at least 7-story high building. It's going to be amazing.
How wonderful. And hospitals today, I don't mean they're all Swanee, but some have, you know, better paint on the walls and some art, better light.
Yes.
It doesn't feel so hospital-y.
Yeah, and there's actually good research now that if you can look out of your hospital window and you can see natural light, you can actually see something that's real, not another concrete wall.
Right.
It actually improves your healing and shortens your length of stay. And you know, as much as I love hospitals, I work in a hospital, it's far better to get better and get out.
Isn't it? I agree. Eve Ensler was in town, who created the Vagina Monologues and has just written a new book and just fabulous. And she survived bad cancer, like stage 3, 4. And she said what helped her, one of the things that helped her the most, a tree.
Yes.
Like she bonded with the tree outside her room. I don't mean the doctors didn't help too, but she said every day when she thought the darkest thoughts, that tree. Amazing, isn't it? Because healing is amazing and it's...
And there's a whole field, it's called evidence-based healthcare design, and we're actually doing research in that, and we're finding out how to design hospitals for the future.
I know your passion right now is at Children's, and of course raising money at the telethon, but your international medicine passion runs deep, does it not?
Very deep, yes.
So last time you were where?
I just came back from Uganda a month ago. That's my 3rd trip to Uganda. I go with one surgeon from Children's Hospital. We bring some trainees with us, residents and fellows, just a few nurses, and we try to keep the team really small because the whole purpose of our going to Uganda, obviously to look after children who would never be able to get these complex procedures done because they don't have the expertise there. But we try to pass on knowledge because, again, it is about teaching them how to do these complex procedures.
Yes, and it takes a village, and it takes doctors to teach doctors. And
Exactly.
I can imagine when you come back here to Children's, after being in Uganda or even in Northwest Territories, other places, that you feel blessed
I am
to
so
work
blessed.
in this circumstance. How many operations would you do a day in a place like Uganda?
Well, it's...
Or I'm sure it depends, but...
It depends, but we start first thing in the morning, and this last time we were there for 2 weeks, and we work till 9 or 10 o'clock every night.
Really?
The need is so great, and you can't say no, and they were complex procedures, so some procedures took 6-7 hours to do. But in 2 weeks, I think we did 107 procedures, and again, all of them, kids wouldn't have been able to get that help if we hadn't been there.
And how do they pick the kids, or do you get to pick the kids?
No, we don't get to pick the kids.
I'm sure not.
Again, we don't feel that that's part of our role. We really want to work with the team, and they assemble hundreds, and they come in and they're waiting for us, and we try to pick cases that are going to be good teaching cases, and also cases that, kids that have been abused in refugee camps. We know that we can do a procedure on a child like that and make a huge difference to their future. So we try to pick those cases as well.
So this weekend, you will be here? Will you? Or will you be in the operating room?
Believe it or not, that's a good excuse. I am on call this weekend.
You're on call. Okay, you got out of doing television.
So first call Saturday, but Sunday I am available.
Okay, great. So it's 15 years of World of Smiles Telethon on
Yes.
Child Multicultural 116. How nice to meet you.
Great to meet you, Fanny.
I always know every person says, ask the anesthesiologist about what goes on in the operating room, because they know the good surgeons and they're not so good surgeons.
We do, yes.
Remember, you can catch our conversations on YouTube or follow me on Twitter at Fanny Kiefer. There'll be many more enticing, entertaining, thoughtful, and profound guests to come. Thanks for watching Shaw TV and being with me today.